Yeah.
Future medicine, what is it?
Future of medicine? Ooh, you're throwing me back with a deep question.
Come on now.
All right, so future of medicine. Wow. The future of medicine is going to be hopefully good health delivered by caring people in a setting of warm, accessible environment. What's the future of health? The future of health is going to be I think a decentralized care that doesn't involve the hospital as being the primary source of care provider. That people will have various opportunities to get health outside of the sort of structured environment that we've created now. That there will be tremendous advances in medicine that will treat chronic illness in a much more sort of more exact way. Cancer therapy will look back on what we do to people now and think that it's the dark ages of medicine. I think that we'll find people are living much longer. So the fastest growing population in this country right now is those over the age of 85. And so we are going to have a lot more healthy elderly people who are not going to tolerate functional disability and will want to live like my 103-year-old grandmother did, fully right up into the day they die. And I think that our focus of medicine is going to be aimed more towards that potential for people and hopefully making that a realization. There's going to be much more integration, but I think that's already going on, so I'm not sure that's the future. I think that's what's happening now.
In your office?
In my office and everywhere, I think. I think that there's going to be probably a national healthcare service of some sort in this country that I think insurance companies will be a thing of the past at some point.
I am Dr. Gocke's nurse. I'm a registered nurse.
Yes.
And I take a lot of calls from the patients, talk to them about their medications, help them with prescription renewals, help answer questions, do referrals to other doctors. So there's some education involved, and lab results, radiology results, and field calls for Dr. Gocke, and triage patients, see if there's something we can handle over the phone or if they need appointments, and answer the phone.
There you go.
Yes, ma'am.
Okay. So,
So,
and what is Dr. Gocke's specialty?
Dr. Gocke is internal medicine. He practices in a concierge boutique medicine is what it's called. I kind of prefer to call it selective medicine because it's really just how you want to get your medicine. Do you want your cookie cutter medicine where you have 1,000 patients in a practice and maybe get 15 minutes of FaceTime with your doctor, or do you want a doctor that has fewer patients and can devote a little more time to you? So also what that allows him to do is to discuss different modalities. It's not just here, this is what you have, this is a pill for it. It's this is what you have and this is what I think we can do for that. And he can incorporate different modalities. He can use whatever he thinks is going to be best for that particular patient. And that's where the alternative medicine part of his practice comes in. He does herbs, refers to the acupuncturist, the psychologist, kind of focuses on holistic and preventive maintenance rather than just treating disease. So.
And you've been working with the acupuncturist in your office for a while?
Been working with the acupuncturist in our office, and I think one of the things that has been so exciting is we've had patients who you would think would never be receptive to anything other than just straight Here's your prescription. Here's what's wrong. Here's your prescription. Give me a pill. Give me a pill. And these people are responding to acupuncture, and it's so exciting because you would think that they're never going to go for it. And then some of the people that I would have probably, if I were a betting woman, have put money on, would not have responded, have just responded so well and can't wait to come back again. So that's exciting because they do this combination of medicine and then they go out and they're telling other people about it. So that's just very cool.
Who is that physician?
What's that?
Who is that physician?
That would be Dr. Ken Gray. And it's just been such a nice addition to the practice because it's given us another whole area where we can send patients. And we don't just have to stop at the prescription that we give them. We can give them a prescription for oriental medicine or acupuncture, and that can just kind of augment what Dr. Gocke does for us.
That's been about how long would you say you've been working with him?
It's been since the first of the year, I think, so it's probably been close to a year. And we've seen just dramatic growth in that area as far as the people who are either word of mouth or they have a spouse that's come in and responded well, so they're coming in for everything. Everything from headaches, migraines, people who've taken every migraine drug on the market are coming in and they're getting relief.
Do you have any personal experience with him?
I do have personal experience. Actually, he's treated my daughter for stress and relaxation, and she responded dramatically well. And again, you know, it's kind of a iffy situation there because you have so much emotion, but it's been great, and she can't wait to come back from college so she can have more treatments.
Thank you, Ms. Camille.
Thank you very much.
And what's your full name?
Camille Egan. I'm an RN.
How long?
Years. 25 years.
Good. Thank you.
Thank you.
Tell me your name, Doc.
So I'm Mitchell Davis. I'm a physician, gastroenterologist, and I became a patient of Dr. Ken's through a close personal friend of mine who's been a patient. I was looking at having a major back operation. I was told by 2 university medical centers there really was no choice, but after looking at the ups and the downsides, I wound up with Dr. Ken, and I've had really exceptional results, and I know that my yoga and physical therapy has had something to do with it, but a couple of days when I've been here, I've had unbelievable improvements after I left with both paresthesias in my leg and strength. They've all gotten better with the different acupuncture techniques that we've worked with so far.
Where's your office based out of?
I have offices in West Palm Beach and Wellington, Florida.
And which hospital?
We go to Columbia Hospital and Wellington Regional Medical Center.
Awesome. Thank you.